What are some factors that influence ISQ measurements? Well, one thing that was evaluated was that there's no influence on the direction of measurement. In general, we want to get two measurements, and either you're going buccolingual or mesiodistal to really get those two, and people either will write down both, indicate both of the measurements, or take an average, but certainly getting it at two different angles or directions. Generally, the ISQ measurements are higher in males, but there is some conflicting data out there in the literature. Generally higher in the mandible versus the maxilla, and especially at placement, which again we can imagine due to the quality and quantity of bone that's generally present in the mandible. And then, of course, looking at immediate versus delayed placement, when we're doing an implant placing immediately, then we're not going to have bone all the time, all the way around the diameter of the implant. And so that would make sense that we would often have lower ISQ values. Wider diameter implants generally have higher values. And the data in looking at implant length is not necessarily consistent. So it doesn't seem that a longer implant is going to have higher ISQ values.